Hello, my name is Christophe Go. I'm a child psychiatrist in the University Hospital of Lyon, and I made a cursus in computational neuroscience, and I'm currently a PhD student in philosophy of medicine. And I want to present a conceptual framework for training young physicians in the interdisciplinary challenges of AI in medicine. I have no conflict of interest. So what is AI, or artificial intelligence? So it's a scientific discipline which seeks to reproduce a function of human intelligence with statistical algorithms like neural networks. And we can consider three axes, like a theoretical hypothesis, which are used to give a freedom to data, and they can exploit structured knowledge with a lot of models, AI models like machine learnings. But the scientific discipline of AI have also a lot of other adjacent disciplines like robotics, human science, and others. And there is an important increase in the publication since a few years and since a few decades ago at the beginning of the AI. So we can identify some changes in AI pedagogy. First, the interdisciplinary changes like computer science, computational medicine, and the interest for clinical practice. And we can identify methodological changes like pedagogical, technical, ethical, or also epistemological changes, because we have a lot of concepts that medical students have to learn about AI. So AI medicine programs were developed in different institutes, like in University of Toronto or Harvard Medical School. And we can have a lot of models to develop some pedagogical framework. But what is the problem? The problem is in the scientific field of AI, it's a transversal and multidisciplinary fields with a lot of educational resources and a lot of platforms and other pedagogical platforms and other resources very various and coming from different scientific disciplines, and all that could lead to a versatility, a volatility, or an instability to the definition of the concept of AI. So if we want to have a solid pedagogical framework to learn AI to medical students, we have to think about solution. What could be such solution? Maybe develop core educational principles around AI concepts. So develop a theoretical, methodological framework structuring AI medicine interface with a set of conceptual competencies. Conceptual competencies, I will define just what is it after, and they can be integrated into an educational program. So what are conceptual competencies? Theoretical definition, a transformative awareness, how the conceptual assumption held by clinician, researcher, or others influence, shape clinical care, to avoid implicit preconceived ideas on AI or other concepts around AI. So the role of such a set of conceptual competence is to provide a generalizable framework and build an educational program for AI structured and integrating different levels of skill acquisition, like in the Bloom pyramid. So when we develop conceptual competence, we have a robust pedagogical framework without versatility or volatility of the concept. Okay, so conceptual competence could be theoretical, but not at all, because conceptual competence could be implemented directly in the pedagogical program and around an hypothesis. My hypothesis is to develop conceptual competence at the interface between AI and medicine. It's to say that to teach AI to medical students, that requires that students have to learn AI reasoning as they learned clinical reasoning. Because there are a lot of similarity and parallels, comparisons between the both. And we showed that in a recent article. In blue, the decision maker, the clinician or the physician. In green, the AI model. And at the left of the slide, we see a lot of things that both clinician and both AI model make, like labelise variables or structuring it. So what does the clinical reasoning pedagogy say to support AI pedagogy? So when we learn clinical reasoning, we have to learn 4 conceptual competencies, because we have to ask the right question, know the right tools useful in clinical practice, know how to discuss and debate these tools, concept and question, and we have to keep an humility. And it's the same for the conceptual competence in the IA pedagogy. To learn IA to medical students, we have to consider that they have to ask the right question about AI concept, they have to know the right concepts or tools useful in AI, they have to know how to discuss and debate on AI, and they have to stay humble. And we just define says 4 conceptual competencies, because we can define conceptual question, conceptual tools, conceptual discourse, and conceptual humility. And as we will see, says 4 conceptual competencies should be detailed in the AI educational program successively, one after the other. So to have a good framework to pedagogically learn to transfer knowledge to medical students about AI, we have to use says 4 conceptual competence to have a solid and robust definition of the concepts, AI concepts. So of course, says 4 conceptual competence could be put in parallel with the 4th levels in the Bloom pyramid, or in the taxonomy of significant learning. They have similarity with the integration and application levels and others. But the difference in the conceptual competence are both theoretically but also pragmatic things or conceptual competencies implemented in the pedagogical program. So first, in this pedagogical program, we have to develop conceptual question. To learn clinical reasoning, we have to ask a good question. To learn AI reasoning, we have to learn the good question. Example of conceptual question: what are the similarity between human and artificial intelligences? How is AI different from statistics? Why not leave the AI opaque? Or what are the social representation of AI? So conceptual competence are based on technology, understand the result, explain the result, and all that go through the knowledge of conceptual questions. Secondly, we have to conceptualize tools, because in the pedagogical program, if we have no tools, we can understand the different concepts. So tools are something like branches, terms, methods, or domain and application that AI is used to in the clinical practice or other. So we have a lot of visualization, we have a lot of resources, a lot of courses, a lot of platform where we can put all these concepts and to have a lot of definition and a lot of and the hierarchy on these concepts. Third, we have to develop in the pedagogical program a conceptual discourse. So maybe the most important, because it corresponds to the use of conceptual question tools and the application of these tools in the educational program with the development of reflective explicitation skills, like could you explain what is a neural network, what is singularity, what are the biases about AI or the ethical limits. And finally, we have to develop a conceptual humility, like when we want to draw something very difficult, we don't know everything, and it could be have two axes, like a posture and an ethic. A posture because all the concepts in AI, there are fuzzy and there are thick concepts with a lot of dimensionality. There is no a sharp boundary, but rather vagueness, and we have to learn that prototypical approach and what is complexity. To understand AI, like in clinical practice, we have to learn this complexity. And secondly, we have to develop ethic of AI, to develop humility with the 4 clinical principles, and of course the explainability principle around interdisciplinarity, responsibility, and the human guarantee. And so we have a lot of programs about ethics of AI. Finally, we wrote in a Psychological Medicine an article around the challenges of AI and pedagogical challenges at the clinical level, but also at the academic and collaborative levels. So with the need to develop curricula both in data science and biomedical engineering, encourage the programs between scientific, ethic, and epistemological programs. So, young physicians should be trained in the interdisciplinary challenges of connecting medicine and AI. Due to the diversity of knowledge required and the versatility and stability of AI concepts, solid theoretical and methodological foundations are necessary, which go through a pedagogical framework very robust. Therefore, we propose to develop some of this program around 4 types of conceptual competencies: conceptual questions, tools, discourses, and humility. And this set of conceptual competencies allow to structure and systematize AI knowledge and AI know-how. Thank you for your attention.